Welcome in, everyone. I am so thrilled to have you here today. Okay, let's just dive right into this because today we are deconstructing a historical myth that has persisted for decades. You know, when we think of John F. Kennedy, the 35th President of the United States, we picture youth, right? Vitality, boundless energy. But newly unsealed 2025 medical records paint a dramatically different picture. Behind closed doors, completely away from the cameras and the public eye, JFK's life was defined by unimaginable, chronic, physical agony. So today, we're going to use these newly released records to piece together the hidden medical history of a president whose body was literally failing him. It's a powerful reminder of the immense lengths we'll go to curate our public image and the invisible reality of chronic pain. Ask not what your country can do for you, ask what you can do for your country. We all know this, right? This is the JFK the world remembers, a dynamic, youthful leader, incredible eloquence. I mean, he was the man who spearheaded the Apollo program to send humans to the moon. He decisively navigated the Cuban Missile Crisis to avoid a catastrophic war, pushed for civil rights. He deliberately cultivated this persona of being an incredibly active, vigorous leader. But here's the thing. Protecting that image, it required a monumental cover-up for both political and personal privacy reasons. And when you look at the private moments, it is jarring. We're not talking about a guy with a slightly bad back. We're talking about a man who often had to heavily rely on crutches just to move from point A to point B. The truth is, JFK was battling constant, severe pain that haunted him relentlessly. His vibrant, energetic public appearances were often preceded and followed by excruciating physical struggles. What we're really looking at is the physical toll of a lifetime of compounding medical issues completely concealed to preserve his political viability. Section 1. War Hero's Burden. The Origins of the Pain.
Now, his physical struggles didn't just suddenly pop up during his presidency. To truly grasp the depth of his medical challenges, we have to go all the way back to the beginning. Honestly, it's staggering to look at the sheer volume of ailments he faced early on. He was never really a healthy kid. Pertussis, chronic enteritis, asthma, severe allergies, you name it. Then he gets to Harvard and he sustains significant back injuries playing American football and tennis. By the time World War II broke out in 1941, he tried to enlist but was flat out rejected by medical examiners. They cited issues like asymmetry in his gluteal muscles and a highly unstable lumbosacral joint. The doctors couldn't even agree on an exact diagnosis. But, a military record was absolutely essential for a future political career back then. So leveraging his father's powerful political connections, he manages to bypass the medical rejections entirely and secure a spot in the Navy.
Picture this, JFK as a young commander of a PT boat in the Pacific Theater. He looks exactly like the quintessential American war hero. And honestly, he was. When a Japanese destroyer literally rammed and sank his boat, JFK displayed extraordinary heroism. He dragged a severely injured crewmate to the nearest island by clenching the strap of the man's life jacket in his teeth, swimming for over 5 hours. 5 hours? This incredible act of survival and leadership earned him a Medal of Valor, for sure, but it came at a massive personal cost. That extreme physical exertion permanently devastated his already fragile spine. Section 2. The First Failed Surgery. Conflicting Medical Advice. So, the pain following the war didn't just linger. It escalated. It got to an unbearable level, spreading all the way down into his hips and knees. It forced the ambitious young Kennedy to seek major medical intervention, bringing him to a critical, life-altering crossroads. The dilemma was pretty clear. On one side, you have the Mayo Clinic. After running tests, their medical team said, "Look, we can't clearly diagnose a herniated disc here," and they strongly advised against surgery, recommending a conservative approach. On the other side, Dr. James L. Poppin, a very prominent neurosurgeon of the time. Driven by the severe radiating pain, JFK bypassed the Mayo Clinic's caution and opted for Dr. Poppin's aggressive surgical route, undergoing an L4-5 laminotomy and an L5-S1 discectomy. And here's the absolute tragic irony of that decision. During the operation, Dr. Poppin noted in his own records that he actually didn't find a clearly herniated or a ruptured disc. Despite this, he proceeded to scrape away a large amount of tissue anyway. The outcome? Disastrous. The surgery provided absolutely zero relief. Instead, it left JFK suffering from severe muscle spasms and forced him to rely far more heavily on painkillers just to get through the day. This marked the very first of his failed back surgeries. Section 3. Addison's and Political Rise. A body failing, a career soaring. As his body continued to fail him, his political obligations were only getting heavier. Following the tragic death of his older brother Joe Jr. in World War II in 1944, JFK suddenly became the political heir of the Kennedy family. Just look at how his ambition completely clashed with his biology. In 1946, he runs for Congress. Imagine this, campaigning, shaking hands, giving energetic speeches, while secretly relying entirely on crutches, locked in a stiff back brace, and requiring daily heat treatments just to physically function. Then comes a massive blow. In 1947, he's diagnosed with Addison's disease. Yet, despite his rapidly deteriorating health, his political star kept rising, culminating in his election as a U.S. Senator in 1952 at just 35 years old. Let's pause here for a second because we really need to define what Addison's disease meant for JFK. It's a chronic condition where the adrenal glands fail to produce enough vital hormones. To survive, JFK required lifelong treatment with corticosteroids, drugs like cortisone and hydrocortisone. Now, while these literally kept him alive, the disease itself caused profound chronic fatigue. But here's the real kicker. The long-term, continuous use of these steroids severely weakened his immune system and his bone density. This directly exacerbated his back issues and made any future healing a massive, dangerous challenge. It was like a ticking time bomb. Section 4. The Wilson Plate Disaster. A mechanical fix goes wrong.
Fast forward to 1954. JFK had his Addison's disease somewhat managed, but his back pain was this agonizing constant. An X-ray revealed that the disc at his L5-S1 level had collapsed by a staggering 70%. Desperate, he turned to Professor Wilson, a famous surgeon of the era. Dr. Wilson and his team approached JFK's spine almost like a mechanical engineering problem. First, they believed the collapsed disc caused structural instability and was physically pinching his nerves. Second, they acknowledged his pain was multifactorial, made way worse by the damage from that first failed surgery. So their hypothesis? A fusion surgery. They decided the only way to cure the future president was to mechanically lock the abnormal joints together to stabilize his spine once and for all.
And this was their proposed fix. It's an anatomical drawing of the Wilson plate, literally invented by Dr. Wilson himself. It was a heavy metal plate made of vitalium designed to be physically screwed directly into the bone, bent to match the natural curve of the lower back. The goal was to rigidly fuse the L5-S1 and sacred iliac joints. So, in October 1954, they opened him up and bolted this metal hardware right into his spine.
What followed was nothing short of a medical nightmare. Almost immediately, JFK developed a massive urinary tract infection that pushed him into a near-fatal coma. He barely survived that, but even after waking up, the nightmare wasn't over. He developed a severe staph infection straight into the deep surgical wound. It just wouldn't heal. There was a constant oozing of blood and pus. At its absolute worst, pieces of dead bone were physically falling out of his open wound. Doctors heavily blamed his long-term reliance on steroids for totally crippling his body's ability to fight off the infection and heal the tissue.
It was just a cascading tragedy. Surgery number 2 happened in October 1954 to put the plate in. Because of the horrific infections, by February 1955, just 4 months later, they had to rush him back into the operating room for surgery number 3 just to rip the metal plate back out. And even that didn't end a misery. The infection lingered so stubbornly that 2 years later, in 1957, he had to go under the knife for a 4th time simply to drain the ongoing buildup of pus in his back. Section 5. Failed Back Surgery Syndrome, a classic medical case study. So we have to ask, after all of this trauma, all these operations, did it actually work? Well, later X-rays showed that the surgery did manage to create some partial structural fusion. But in terms of relieving his agony, complete failure. Today, JFK's medical history is literally immortalized in medical journals for all the wrong reasons. His 4 operations, encompassing both a discectomy and spinal fusion, serve as a textbook officially documented case study of failed back surgery syndrome, or FBSS. This is a very real condition where, despite a surgeon successfully altering the mechanics of the spine, the agonizing pain continues unabated or even gets worse. Imagine enduring the knife 4 times, surviving comas, and waking up to realize the agony is exactly the same as before. That was JFK's daily reality. He could no longer rely on surgeons. The scalpel had completely failed him. So as he stood on the precipice of the presidency of the United States, carrying the weight of the free world on a shattered spine, he had to pivot. He turned to a radically different conservative approach led by a pioneer in myofascial pain, Dr. Janet Travel. But it leaves us with a massive question. With a body this fundamentally broken, and the brutal weight of the Cold War pressing down on him, could a simple change in medical philosophy actually save a presidency? Thank you so much for joining me on this deep dive today, and keep questioning the history you thought you knew.